Everything I was taught about the goal of being a plastic surgeon was wrong. There is a saying in the world of surgery, to cut is to cure, or the only way to heal is with cold steel. So as surgeons, we kind of gauge our success based off of the operations that we're doing. If you're a general surgeon, then the cream of the crop, the big operation that you hope to perform someday is the Whipple. The Whipple is a huge 10-hour cancer operation that if you're so lucky to scrub into a Whipple, you know you've made it. In plastic surgery, that operation is probably the facelift.
I'll make you 20 years younger.
Oh, Dr. Jaffe, you are a genius.
Patients may trust almost anybody in some ways to do their liposuction, but you know that if you're going to do their facelift, they really trust you. And so for many years, I actually gauged the success of my practice based off how many facelifts I had on my schedule. And several years ago, I thought that I had reached the pinnacle of success. I had patients flying in from all across the country to see me to have facelifts done, and I had a waiting list of over a year to a year and a half. And then I had a patient who completely changed my life and my career forever. This was a beautiful 60-some-year-old woman who came to see me for a facelift. She was overall healthy, we had her cleared by her cardiologist and by her internal medicine physician, and then I performed a facelift surgery on her. The operation went perfectly well with no problems whatsoever, and she did fine, and we discharged her from the hospital the next day. But then she developed a horrible complication. It wasn't her fault, it wasn't my fault. Sometimes bad things can happen. So in this instance, bad things did happen, and it really sent me into a spiral. I felt so guilty that my patient suffered from this operation and the fact that it was an elective surgery. Even though there was nothing I could have done to prevent this complication for her, other than just plain not operate on her, I felt really responsible for what had happened to her. I started really thinking about the practice of medicine, and especially the practice of surgery. Was I doing no harm? We know that there's an oath that we take as physicians to do no harm, but was I actually doing harm to my patients? I mean, when you think about it, here I am as a plastic surgeon, I'm taking somebody who's healthy, I'm operating on them, making them unhealthy, and then we expect that they're going to be healthy again afterwards. And I realized after many months of contemplation and soul searching, my goal should actually be to keep my patients and my followers out of the operating room, yet figure out how to help them look and feel their best without ideally going under the knife. And so I spent many years and thousands of hours trying to figure out just how to do that. Now here's a little background. I went to traditional medical school at Michigan State University. I had my MD. I did 3 years of general surgery residency training. I did 2 years of plastic surgery residency, and I spent a year in Beverly Hills with a top name plastic surgeon out there as a fellowship. And throughout all this time, I had virtually no real education on nutrition, on skincare, or non-invasive ways to turn back the clock and to look and feel better. So I started reading books by holistic and alternative health practitioners, by nutritionists, by dietitians, by dermatologists, and other physicians to learn that which I had never learned before myself. And I came to a realization that our body contains immense regenerative abilities to rejuvenate itself. Yes, our bodies are these incredible machines that want to be healthy. They want to be youthful, they want to be energetic, they want to be vibrant, but we have to give it the right tools and the right environment for it to do so. And this is where I developed this concept of autojuvenation. It's using your body's own regenerative abilities to rejuvenate itself. And this concept of autojuvenation revolves around 5 main things. There are 5 things that you can do to literally autojuvenate your skin to become more vibrant, more youthful, and honestly, younger looking, even 5 to 10 years. And these 5 things are what you eat, when you eat, nutritional supplements, skincare, and non-invasive treatments. And I fully believe that if you focus on these 5 things, that the vast majority of people can feel and look incredible, hopefully so much so that they never feel the need to go under the knife. So for the diet, you want to start by eating a diet that is filled with colorful fruits and vegetables. These are filled with antioxidants that can fight free radicals and oxidation. You also want to eat a diet that has healthy sources of protein, like cold water fish, grass-fed beef, pastured pork and chicken, and pasture-raised eggs. Adding in healthy anti-inflammatory fats like those found in olives and olive oil and avocados can also really reap major benefits on your skin, in addition to adding fermented fermented foods to help to soothe the microbiome. We know that there is a direct correlation between the health of your gut and your gut microbiome and the health of your skin. But it's also not enough just to eat the right foods. It's also important to give your body a rest from eating for a good 12 hours at least, even up to 16 hours every so often. By practicing an occasional intermittent fast, it can help your body's intracellular rejuvenation process to kick in. And this is a process called autophagy. By allowing your body every 16 hours, maybe once or twice a week, to not eat, that will give your body a chance to actually use its intracellular waste products as fuel sources. And this can help clean out your cells from the inside and help them to function more efficiently. Now, number 3 are nutritional supplements. And even though you can't supplement yourself out of a bad diet, supplements can definitely help to improve the health of your skin and even your whole body. And there are certain very simple daily supplements that I recommend for virtually anybody. And these include a daily multivitamin, a daily probiotic with at least 3 billion colony-forming units, an omega-3 fatty acid, and a collagen supplement if you're not vegan or vegetarian. Yes, collagen supplements do work. Studies have proven that over and over again. Number 4 is skincare, and I know I've covered skincare on my videos before, but it's important to focus on at least 2 products that everybody should have in their skincare routine. And that is, every morning you should use an antioxidant like vitamin C. Every other evening, I recommend using a retinol. Now, if you're sensitive to the effects of retinol, then try bakuchiol instead. By doing a good skincare routine, you can really affect your skin from the outside in. By focusing on the diet, you can treat it from the inside out. And the final thing that's so important are non-invasive treatments. And one great non-invasive treatment for your skin includes red light therapy. Red light therapy is believed to work to improve the skin by actually powering the mitochondria of your cells, causing them to produce more ATP or more energy. This can supercharge your cells and essentially make them act more energized and younger.
Vegeta, what does the scouter say about his power level? It's over 9,000!
And the great thing about red light therapy is that it's not that expensive. You can do it in the comfort of your own home, and there's absolutely no downtime to it. Now, there is so much more I'd like to share with you on autojuvenation that goes beyond just a simple YouTube video. But for many years as a plastic surgeon, I didn't know what I didn't know. And it really took, unfortunately, a bad thing to happen to one of my patients to realize that there is a better way to turn back the clock than going to surgery first. So if you want to learn more about how to turn back the clock naturally to look 5 to 10 years younger without going under the knife or the needle, I have the secrets for you in my new book, Younger for Life. It goes on sale January 2nd. If you watch this video before then, it's available for pre-sale. Now, pre-orders are super important for authors like myself because the more pre-orders we get prior to our book coming out, the more copies the bookstores will get and the more chance we have of getting it on the front tables. And in order to thank you for pre-ordering the book or ordering the book, please go to autojuvenation.com. We have all the links of where you can get the book, whether it's Amazon or Costco or Barnes & Noble or bookshop.org. We've got the links for you there. And if you do order or pre-order the book, we have a ton of free gifts for you, including a companion recipe guide, a $30 gift certificate to my online store, Youn Beauty, if you want to try our Youn Beauty skincare products, and a whole lot more. Thank you so much for your support. I'm so excited to get this information into the hands of people before they go under the knife to see whether they can help turn back the clock naturally and feel great about themselves and feel great about yourself without feeling the need to actually have surgery. So the link to autojuvenation.com is right up here. Please check it out. Please order or pre-order the book and you will have my undying gratitude. And remember, like always, eat real food, use clean skincare, and autojuvenate before you operate.